I think we're going. Yeah, it says live.
All right.
Hello, welcome to Doc Talk Live. I'm with Bradley Pate.
Nice to meet you. Thank you for coming.
Thank you for having me. I'm Dr. Goodman, and we're continuing on with various content that's medical related. We haven't done a show on pharmacy at all, so I had the opportunity to come over here and talk to you a little bit about being a pharmacist, and tell us why you went into pharmacy.
Sure. Well, I went into pharmacy for the actual service aspect of it. I really liked being almost that front line and being able to interact directly with the patients. We take the time here to really try to understand the full picture of a patient. It's not just, here are the meds your doctor gave you, here's how to take them. I want to actually get to know my patients and understand maybe the reason why they may have high blood pressure, or try to get to some of those underlying causes.
So why would a patient, I want you to speak in more detail about this. Why would a patient fill a prescription from you as opposed to a big chain?
Well, I mean, you can get your medications anywhere. That's one of the issues that is out there. But, we provide far superior service than a big box store.
And what are the services that patients need? What does this say, by the way? It says how to apply. I don't want to draw on there, but people that are watching, let us know if there's any issues. But we appreciate you checking us out live. So go ahead. What are the services that a neighborhood concierge pharmacist could offer a patient that they don't realize they're not getting?
Sure. One of the big aspects we offer is free delivery. We can do free same-day delivery to pretty much all of Birmingham. We're busy these day and age, and things like Amazon have come increasingly popular, where you can just almost click a few buttons and it shows up at your door.
Right.
We basically offer that same service from a medical standpoint. We can bring your medications to your home, to your work.
How about informationally? What could you provide a patient that an Amazon can't or a chain can't?
The personalization to go along with the service. We definitely get to know our patients very well.
Can you help them learn how? Let's say they have to inject their drug, like sub-Q, like
Sure.
Insulin or something like that, or how deeply can you get involved, or also in terms of, let's say they've got multiple medications with multiple different interactions and in different. Can you give us some examples of actual patients that you deal with?
Oh yes, as deeply as the patient wants us to get involved, we're willing to go there.
Take a patient that's, let's say, recent, and tell me how you have treated them.
We're across the parking lot from a psychiatric practice.
Okay.
And so they refer a decent bit of business here. But I had one patient who gets an Invega injection.
Invega. So
Yes.
What is Invega?
It's a antipsychotic, anti-schizophrenic.
Okay.
Comes in multiple dosage forms, typically a tablet, but they also have a long-acting injection.
Okay.
So she gets this injection, or was hoping to get it, once a month. She had been using one of the big box stores just down the road from us, and they filled her prescription for the injection and just handed her the box. And she had no idea how to use it or where to inject it, was scared to death to actually inject it herself.
So where do you inject it?
You can do that multiple places. It's typically in the gluteus. You can also do it in the deltoid as well.
So the gluteus is your butt, and the
Yes.
and the deltoid is your shoulder.
Exactly.
Okay.
Yes. So she panicked, and she called her doctor to see if she could take it back and have the doctor administer it. And the doctor, referred her over here, and I walked her through how to do it so that she could do it herself. She still wasn't comfortable, so I, administered the shot to her here in the pharmacy. And since then, she's been coming back, and she comes in every month on on the day.
So
to,
you always
to get
are
shot.
giving her medicine
Yes.
because it's a monthly medicine.
Yes.
What about drug interactions? A lot of times these medicines are hard to take, or you're taking multiple medicines. How do you help patients with, let's say, nausea or figuring out a way of taking the medicine so that they can tolerate it, or
Sure.
even get it down, or let's say even promote compliance? I would think compliance is an issue.
Yes. Yeah. Adherence and compliance, kind of the same term interchangeably, are huge for pharmacy. I think it's about 75% of patients are not adherent to a drug that they have to take more than once a day. So just getting patients into habits of, we can fill up a medication pill reminder for you, and so you can have your weekly medications already laid out for you. Just trying to get into those routines and habits.
So you have those sort of types of gizmos and gadgets that will help people with compliance with that.
Yes,
Okay.
absolutely. And then we can also sync your medications together so that you're actually getting all of your medications at the same time. You're not coming to the pharmacy or having us deliver, 2 to 3 times a week or 3 to 4 times a month.
Why does it take so long to fill a prescription?
There's-
I know I've had the experience where it's like, okay, you just got to grab a bottle, throw out
Sure.
and put them in another bottle. Why does it take so long to fill a prescription?
Well, there's a lot more to it than just picking it up off the shelf and putting it in a bottle.
Tell us about that. I want to give us the inside scoop.
Sure. Well, honestly, the slowest part is actually transmitting the data to the insurance company to get a proper copay. So we have to decipher the handwriting if it's handwritten.
Uh-huh.
Sometimes that's a struggle. And outside of that, we have to submit a claim to an insurance to see what they will pay for. They may not pay for 3 months of this blood pressure, or only pay for a month of a brand name medication. So the majority of the time is actually spent trying to get the claim paid for by the insurance company. And then the pharmacist is actually then looking at any particular drug interactions that you may have.
Mhm.
So they're going to check that new blood pressure medicine that you started on versus everything else that you are on. And hopefully then, I know we will take the time to counsel you on that, to ask if it's substituting anything, if we are actually changing out, or it's in addition to. So
Another thing that's kind of funny to me, because I've been looking at over the counter. You go through the aisles and you see the various over the counter products, and I was looking for Benadryl the other day, and I couldn't find just Benadryl,
sure.
but I found like Sominex, which is a sleep aid,
Yes.
but it contains just Benadryl, and so it's interesting to me the way things are labeled. Like this is not necessarily for hives, but it is to help you sleep. Like how do people decipher? And another good one was Sudafed.
Yes.
I was looking for Sudafed, and I guess now all the strong Sudafed is behind the counter.
Correct.
You
Yes.
can't, and so if the pharmacy's closed, you can't get your Sudafed,
Correct.
right? But they
Yes.
have these little Sudafeds, like that you can
Yes,
still get that are not behind the counter, but you would need I don't know, let's see, what's this prescription strength of Sudafed? Is it 160 milligrams?
120 is usually your 12-hour.
Okay, so 120 milligrams would be 12 hours, and they've got these little 10 milligram pills that are not behind them. So you'd need
Correct.
to take 12 pills
Well,
in order to get the prescription strength of Sudafed, right?
those are actually different ingredients altogether. So they're different medications.
But they say Sudafedrin 10 milligrams.
They say Sudafed is the brand name because those would be Sudafed PE. Those actually are phenylephrine, which is a similar drug to pseudoephedrine, but it is not actually the same.
Okay, so we got to look at that now. So
Yeah.
Sudafed is what?
Is pseudoephedrine.
Pseudoephedrine, and the stuff that's over the counter is phenylephrine.
Correct.
Okay, so what is the prescription strength of phenylephrine?
Phenylephrine is actually just over the counter. So
So
there's
it doesn't
not
even get behind the counter.
Correct. Yes, and they're
But
they're
it's not.
similar drugs.
What if it said pseudoephedrine?
If it said pseudoephedrine, then it should be behind the pharmacy counter.
So all pseudoephedrine should be behind the pharmacy counter,
Absolutely,
even at the
yes.
lower strength.
Yes.
Well, this was in Colorado, so I think it was pseudoephedrine, but I think they had a in front of the counter and behind the counter brand.
Okay. It
Fascinating to me. Okay.
Yes.
It's I don't know, but we could do if we could. You don't have any. You all have behind the counter stuff.
I have over the counter as well. But
Okay.
yes, I mean I can grab
we-
a box of Sudafed for you.
Let's grab a. This is the stuff that's over the counter, right? Oops, sorry, throwing this place apart. Show me what you have. That's
So that's perfect. So that's the over the counter.
okay. This is phenylephrine.
Yes.
Yeah, that is not pseudoephedrine. But so you have no pseudoephedrine.
Not that
10
it's
milligram nasal decongestant. Interesting.
correct.
And this is
And then that is-
pseudoephedrine. This is so complicated. And this is 30 milligrams.
Correct. Yes.
Okay.
That's usually your
Okay,
4 to 6
is
hour dose.
this is not a prescription strength though.
It is not prescription strength, but it is not available over the counter. You actually have to go to the pharmacy, and
In this state.
yes,
Would
in Alabama, there are limits on how much pseudoephedrine you can buy. You can only buy, I believe it is 2.4 grams per month.
And is this because of the crystal meth issue?
Absolutely, yes. I mean, that's people have.
And I have
found
no
ways
idea how to turn this stuff into crystal meth, so I don't know. Do you know how to do it?
I've got some basis in it. I've never actually done it, but I've done my due research. I mean, I don't think I want to put bleach and battery acid and Sudafed in my body all mixed together. Sudafed,
Is that what it is? Bleach and battery acid is
Pretty
what causes
much,
crystal
that-
meth?
and then it's a chemical reaction that they induce. You use the pseudoephedrine as the active ingredient, but usually it is bleach, battery acid. You'll take the sulfur from from match tips to try to help initiate that reaction as well. It's crazy that somebody actually understood how to do that and figured out ways to manipulate that drug.
That's
But-
unbelievable.
But that's the reason why you can't just go out there and just buy it on the shelf now.
Right, because people are abusing it somehow.
Yes.
And then that leads us to opioids. So what is your take on the opioid crisis?
They definitely are overprescribed.
Mm-hmm.
They're like almost every medication that's on the market. There is a legitimate use for it, and there's a need.
But now, like hydrocodone, for instance, used to be Schedule 3, and now it's Schedule 2. Is that right?
Correct. Yes.
And so it becomes even harder for the patients to get. Have these things had an effect? These changes that the government has made?
Those changes have had a little bit of an effect.
Mm-hmm.
You've got Medicaid is just now starting to scale back their MME, which morphine milligram equivalent, which is their way of measuring how much of an opioid is prescribed to a patient. Because hydrocodone is going to have a different potency than Percocet or oxycodone or morphine, and so it's all based off your morphine tree because that's your basis for most of the opioids. So they've got limits that are put in place to help bring down and kind of scale back the amount of medication that is being prescribed. And Medicaid's not the only provider out there that's doing that. A lot of insurance companies have kind of put in these limitations on opioids to try to alleviate the initial use to where someone's not overprescribed the first time and then becomes dependent, and then also just to scale patients that are dependent on it at this point to help scale them back.
And how do people find you, Bradley? You have a website, right? It's www.
Yes, Go NCP.
GoNCPRX, GoNCPRX.com.
We're located in Trussville. We're right off Highway 11.
But you can deliver,
Absolutely.
so they can just call you.
Sure. Yeah, you can always call. Our number's pretty easy, 205-900-2400. We're open Monday through Friday, 9 to 5. And be more than happy. You can also reach out to us. If you go to our website, there's contact us. You can send us an email.
Perfect.
You can actually text us to that number. We can respond to text messages. Very, very user friendly.
Super. Bradley, I appreciate you taking the time and
Yes.
showing us around and indulging us today. I appreciate it.
Absolutely. Thank you for coming by.
Thank you.